Hi, this is Cat of Sweet Cat Magic. I've been gone for a couple of days. I went over and had surgery on my leg for the varicose veins. And so I just want to talk a little bit about that because I imagine there's some of you out there, you crones, that may be contemplating or might not even be aware or might have some concerns about varicose vein surgery. So I thought I'd just talk to you about that. And also you maidens and mothers to kind of help prevent you from getting that. One of the big factors as far as getting varicose veins is whether you had your mother, grandmother, aunts, all those relatives on your side have had varicose veins, because it's very much genetic. The other thing is if you are overweight, or if you've had multiple pregnancies, carried a lot of babies. And another thing is if you just work on your feet a long time, standing on your legs a whole long time. And so it was really interesting because I had this image of varicose vein surgery from my aunt when she had her veins stripped, and that was 30 years ago, and it was a long painful procedure, and her bed rest was a couple of weeks, and I remember her just saying it was excruciating. So I always had in my mind, it's painful, but they have made tons of inroads into it, and they do it differently than they did. And mine was all covered by Kaiser, and I was just absolutely thrilled. It took about an hour, surgery-wise, but the hardest part of it was I was all prepped and ready in the bed, all ready to go, and it was a 5-hour delay because of other surgeries and stuff like that. And let me tell you, if that's not a challenge to be 5 hours in a bed without your iPhone, iPad, or magazine or TV around. I meditated, and that's good for like an hour, and then you kind of go, okay. Then you try to sleep and that. So anyway, I just realized that I have a little bit of a, harder time meditating for 5 hours than I thought I would. Anyway, so I was back on my feet, able to walk out of there right after surgery, ambulatory right away. Was able to go out to dinner, no effects from the anesthesia, nothing. I was curious to see what it would look like. Somehow a nurse had given me the impression that they had made an incision down my whole leg from the top to the bottom and had taken the vein out, and that's what both my daughter and I thought was. So I was curious. I had to stay overnight, and I stayed in a hotel. It was an outpatient basis, so it was very easy, and I had a nice hotel room. And we went out for, as I said, a nice dinner. And then the follow-up appointment was yesterday, was just Tuesday. And when they did all the unwrapping, I found out they're just little pinholes all down the leg. And that's so it wasn't a giant incision. A lot of bruising. But no pain, really, no pain at all, and not hard to walk. So if you've got a fear of that, if based on my experience, I'm so glad I did it. I took a before picture of my leg when it had all these knots and bubbles and ropes and all this kind of stuff that you could do it. When the doctor kind of marked it, he had a little tattoo pen, and he went down, and I looked like I had a bubble tattoo down my whole leg and running down like a vine down my leg and that. So that was all gone, and not to have those giant ropey blue veins that just stick up and all, feels so good. I can just rub my leg. It feels like a normal leg again. So I just wanted to give a little update on that, and my doctor, I thought, was very wise by saying we do one leg at a time, get that one completely healed, and then we'll do the other leg. So I'll go over next month for the other leg. But if you can prevent them from becoming varicose, those are good things to do. And one of the things, if you stand on your feet a long time, I found that the Dr. Scholl's graduated compression hose at Walmart, they're not as thick as regular compression hose. But if you start wearing those, if you're long-term on your feet, waitress, where your legs are covered so you can wear that, or if you have a job, a store clerk, where you're having to stand, oh, that just will prevent so much of you getting varicose veins. And so I really encourage you to do that. And And if you're older and contemplating it and have any questions or want to, just contact me. Again, I've been having trouble commenting on videos and responding, so this always seems to be a little problem. But anyway, just wanted to give you an update, and I feel so good. And what was really, 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 really cool is I had a friend that took care of the cat house the last 2 days, and she wanted to do it today because I returned last night, and she wanted to continue today. So I'd just like to say that if you have vein problems, not to be afraid of exploring options of getting them taken care of. And I also took horse chestnut root. I had seen that on Dr. Oz where they talked about varicose veins and how that could help. And I found that really helped before I contemplated surgery. That really strengthened the veins and took away a lot of the aches and the pains of the veins. So those are just some options. Aloha. This is Cat, Sweet Cat Magic.